Good morning. I'm Dr. Chinyere A. Ugaji, MD, MBA, on the melange collaboration today, the 10th of April 2015, by approximately 7:30 a.m. Central Time. Our collaboration starts between 7:15 to 8 a.m. between 7 a.m. to 8 a.m. on our collaboration portals, and statistical data analysis also occur throughout this collaboration. And I'll take a few minutes to confirm a technical collaboration yeah, within a few minutes. Okay, so we're back, and I'll go ahead and talk about our mission and goals. This collaboration was established with the mission and goals of creation of collaboration with structured curricula, focus on graduate medical education, with pediatric advocacy, and research has shown that these rates have been improved with concrete mutual legal professional arbitration and privileges in divorced families with out-of-court joint supervision for improved morbidity and mortality. And we'll be talking about this with our field research throughout this collaboration. Research, advocacy, education, careers, healthcare, and global physical activity. And that's a little summary of our mission and goals. Our collaboration schedule today: the modified St. Louis University Mini Mental Status Examination, graduate medical education curriculum, the melange collaboration telecast news, from the White House melange collaboration, news, news telecast with the melange collaboration, healthcare cultural competency, the distinctive forum. So we'll go to the next section of the show, which is the modified St. Louis University mental status examination. So this is actually modified by this collaboration and is required from time to time in education, in careers, and also in graduate medical education. And this has a set of questions which are available on our collaboration portal, and you can be able to contact me to have a copy of it. So the first section is the name. What is your name? Mine is Dr. Chinyere A. Ugaji, MD, MBA. What is your age? My age is 33. Is education allowed? That's a yes for me. Level of education, that's graduate goal for me. What day of the week is it? Today is a Friday. What is the year? This is 2015. What states are we in? You could be in Alaska, in Washington, in Nigeria, in Uganda. Please remember these 5 objects. I'll ask you what they are later. An apple, a pen, a tie, a house, and a car. You have $100 and you go to the store and buy a dozen apples for $3. and a tricycle for $20. How much did you spend? So that's $23. How much do you have left? That's $77. Please name as many animals as you can in 1 minute. 0 to 4 animals gives you a score of 0, and 5 to 9 animals gives you a score of 1. 10 to 14 animals gives you a score of 2, and 15 plus animals gives you a score of 3. So we'll go ahead and name as many animals as we can. 15 plus animals will give you a score of 3. So an ant, a beaver, a cat, a dog, an elephant, a frog, a gorilla, a horse, an iguana, a jackal, a lion, a monkey, a nightingale, an owl, and a parrot. I hope you were able to get as many animals within the listed time. What were the 5 objects I asked you to remember? And those objects were an apple, a pen, a tie, a house, and a car. I'm going to give you a series of numbers, and I would like you to give them to me backwards. For example, if I say 42, you would say 24. So 87 would be 78. 649, that would be 946. 8537, that would be 7358. This is a clock face. Please put in the hour markers and the time at 10 minutes to 11 o'clock. So you can check if the hour markers are okay and if the time is okay. Please place an X in the triangle. You can perform that activity if you're able to. Which of the above figures is largest? And that's the square for me. Then the next one is, I'm going to tell you a story. Please listen carefully, because afterwards I'm going to ask you some questions about it. Jill was a very successful stockbroker. She made a lot of money on the stock market. She then met Jack, a devastatingly handsome man. She married him and had 3 children. They lived in Chicago. She then stopped work and stayed at home to bring up her children. When they were teenagers, she went back to work. She and Jack lived happily ever after. What was the female's name? Well, her name was Jill. What work did she do? She was a stockbroker. When did she go back to work? When they were teenagers. What state did she live in? She lived in Chicago, that's Illinois. So a score of 27 to 30 is normal for high school education, and a score of less than high, and a score and a normal score for less than high school education is 25 to 30. So we'll go to the next section of the show, which is from the White House melange collaboration. And this is collaboration with leadership globally, with a focus on leadership at the White House, conceptualized on formal collaboration portals, presidential speeches, first lady speeches, speeches from the presidential offices, press conferences, White House events. On various topics including female education, Charter of Students' Rights and Freedom, legal enforcement, reform disclosures, independent consumer financial protection jurisdiction, nuclear program advancements, economy, defense, women, Easter and Passover, the Easter egg roll social with knockouts, Easter egg roll and Give Me 5 campaign, and from the Office of the First Lady, the Reach Higher initiative by the First Lady, and the Let's Move initiative with Healthy Lunchtime Challenge, historical celebrations, and Easter etymology celebration from the melange collaboration. So the next section is news. And we'll go into the next section, which is April as Alcohol Awareness Month. career planning, education, health and conferences at the American College of Physicians 2015, health literacy and national research network, new national conference home and family physicians in healthcare, health policy, and a cited advocacy material by Dr. Barbara Levy, the Vice President of Health Policy, the Sunshine Act 2014, 2014, autism with the epidemiology of 1 in 68, and a proclamation from President Barack Obama. April as National Child Abuse Prevention Month, from the American International School of Medicine, Guyana, Capella University, Davenport University, American College of Physicians, American Academy of Family Physicians, AFP National Conference of Family Medicine residents, and National Students and Family Medicine Interest Group, the American Congress of Obstetrics and Gynecology, American Psychiatric Association, the American Pediatrics Association, Health and Human Services blog. Some more healthcare news is 62 as the number of kidney transplants in 2014. Nutrition with news 8-day break, Doctor's Day celebration, patient care by a spinal cord injury patient, synopsis and accreditation council of graduate medical education core competency with labor and delivery procedures at University of Arizona College of Medicine, duty hours, and I also invite you to learn about the night float system with this collaboration. Media on cardiac surgery, physical activity with nurses, and match data. That's from the UT Southwestern Medical Center, Bello Health System, Kindred Hospital, Dallas, Texas, Select Medical Hospital, Association of American Medical Colleges, Albert Eastern College of Medicine, New England Journal of Medicine, Lake Charles Memorial Health System, Louisiana, National Resident Matching Program, and we also have the melange collaboration with Cosmo, with a health fair by 9 a.m. Central Time, and and a health and a clinical station by 1 p.m. Central Time. And you can in Dallas, Texas. And you can contact me for more information on this health fair. The address is 1812 North Haskell Avenue, Dallas, Texas 75204. So if you are interested in attending this event, you can contact me for information on how to get to this event by flight, by road, by rail, and also if you want to be part of this collaboration's clinical station, which starts by 1 p.m. Central Time till 3 p.m., which is when the event ends. You can be able to contact me for more information by sending me an email, calling me, or contacting me through our other collaboration modalities. An addendum from the World Health Organization is C-section information about which actually might be a risk to the mother and the baby due to the indications, a prolonged labor, and also the baby being in an abnormal position. There's also information about physician leadership from the British Medical Journal. Foreign policy is also featured on various collaboration portals, and these are the trending topics which we try to bring you in our telecast news and this collaboration. So we'll go to the next section of the collaboration, which is the American Board of Family Medicine question, and this is actually for those who are taking their board exams. These questions are actually available on the American Board of with the American Board of Family Medicine, and we try to bring you these questions on a regular basis with the answers, the rationale, and also the case presentation to be able to give you the information that you can be able to use to be able to have a high score on your board exams. So on the question of the week, and this is a 40-year-old white male was seen 4 weeks ago for a sudden onset of cough and shortness of breath. At that visit, his oxygen saturation was 92%, but his examination and a chest radiograph were normal. You prescribed azithromycin, Zitromax, and an albuterol inhaler, Proventil Ventolin. 10 days later, he was feeling well and his oxygen saturation was 97%. Today, he returns to the office with a dry cough and shortness of breath. On examination, he has rare inspiratory rales that clear with deep breaths and has an oxygen saturation of 86%. A chest film and a D-dimer test are normal. Pulmonary function tests show significant restriction that improves not only minimally with albuterol. He has no history of asthma and has no smoking history or occupational exposure. However, he reports that 2 months ago, his home was flooded after a heavy rain, and he has been tearing out carpeting that was ruined by the flood. Which one of the following is the most likely diagnosis? And the options are listed. A is persistent asthma with acute exacerbations. B is Legionnaire's disease. C is pulmonary embolism. And D is hypersensitivity pneumonitis. So so yeah, I'm looking at the question. The patient has risk factors of having exposure to a flood, to irritants from carpeting. He has a cough and shortness of breath, and also inspiratory rales on physical examination, and And lab testing showed and imaging showed um, um, normal chest film and D dimer, um, and, and a restrictive pattern on pulmonary function testing. With all this information, the answer is hypersensitivity pneumonitis. And I'll do a case exposition on hypersensitivity pneumonitis. This is inflammation of the alveoli of the lungs due to exposure to irritants. That's the definition. Epidemiology, how common is it? 4.2% prevalence. What are the risk factors? Well, occupation, smoking, and then what are the causes? And this is caused by hypersensitivity and inflammation of the lung vasculature due to exposure to irritants. And the hypersensitivity classification is hypersensitivity 3 and 4. And what are the differential diagnoses? Well, asbestosis is one, bronchiolitis is two, chronic obstructive pulmonary disease is three. Um, Also, you have asthma, you have Farmer's disease, that's five. Then you also have sarcoidosis, you also have interstitial pneumonia, you also have pneumonia, you have eosinophilic pneumonia, and also lung cancer could also be a differential. Then what are the symptoms? These are normally elicited during the patient encounter, um, and with questions structured around the patient's chief complaints and also the patient's symptoms. So the symptoms normally are fever, fatigue, and then also a cough. And then on physical examination, the physical examination findings on general examination, you can see um, notice pallor, also crackles on auscultation of the pulmonary system, and also clubbing on on clubbing and peripheral cyanosis on inspection of the extremities. Um, Lab findings, a complete blood count, a comprehensive metabolic panel, a sputum gram stain and culture, a sputum for acid fast, for AFB, and also other specialized testing, a blood culture and gram stain, will be able to help in the diagnosis. Imaging, a chest X-ray, a CT scan, an ultrasound, are also helpful. Procedures, a lung function test, checking for FEV1, FVC, and the ratio, and also a lung biopsy if you suspect lung cancer. A 6-minute walk test, can also help. Um, in then for consults, a family medicine physician, an internal medicine physician, and a pulmonologist, and also an infectious disease specialist might also need to be on board. Treatment is normally avoidance of the irritants, and also steroids, prednisone. 60 milligram is a good starting dose for prednisone. Follow-up is a regular scheduled follow-up visitation with, um, with the above listed physicians. Prevention is avoidance of these irritants. And then the final diagnosis is hypersensitivity pneumonitis. Coding and billing is J67 for ICD-10 and 495 for ICD-9. And the power question is hypersensitivity pneumonitis has a prevalence of 4.2%, and you can take a shot at that power question. And we and also contact me for Powerball prizes. We talked about it a few minutes ago. It's 4.2%. That's the prevalence. So from the World Health Organization is food poisoning, and also from the Center for Disease and Control and Prevention, with 2 million people being the mortality rates annually. From the Dallas Independent School District is Nutrition by American Heart Association CEO Nancy Brown. From the Institute of Health Improvement is patient safety, and I have a media on conversation readiness with a quiz, and with a quiz. So in your daily routine careers in education, healthcare, leadership, other careers, how do you initiate a conversation? The patient encounter. Hi, I'm Dr. Chinyere A. Ugaji, MBA, MBA, and I will be your physician today, and I would like to know what brought you in here today. Or do you confront them, physically, or by saying, I want to confront you. I would like to discuss an educational model with you. Do you communicate with domestic violence? Do you send out national security broadcasts? Do you post a Twitter hashtag, a Facebook follow, a WordPress or LinkedIn follow? So all these are collaboration modalities. Phone call, text, emails, email marketing websites are all collaboration modalities which can be able to improve the rates of conversation readiness in any within an institution, an organization, or a team. So next on the schedule is healthcare cultural competency, and this is cultural competency for healthcare and also other careers. In being able to communicate effectively with patients, with culturally diverse individuals or patients. We've had healthcare in Spanish. We've talked about everything from pain, the law, to weight and appetites, peso, el apetito. And also we also have this in other languages, and you can contact me to, and also collaborate with us, and these are collaboration. From the Distinctive Forum, we have a survey for the audience to rate the educational models. For Accreditation Council of Graduate Medical Education CAR Competency Certification, patient care, medical knowledge, system-based practice, practice-based learning and improvements, professionalism, interpersonal skills, and communication. Willingness to write a letter of recommendation, willingness to offer a graduate medical education position, observership, clinical rotation, willingness to enroll in this collaboration, and describe any technical glitches experienced during collaboration, auditory glitches, visual glitches, and other technical glitches. So statistical designs in research from our collaboration modalities have shown that these opportunities are evenly distributed in these regions in the United States of America, with formal graduate medical education starting in June and September, and information on complete educational media without technical glitches, which is resolved with the technical departments, can be is available by contacting this collaboration. So I would also I want to invite you to complete the above survey formally. I'm formally answering the question: how does education, health, careers, leadership occur in seconds, minutes, hours, days, weeks, months, years, decades, millennium, globally? And then from healthcare with kids, we've had a lot of activities for our kids with structured curriculum, which is incorporated in organizations globally, uh, and we actually have we've had motor cars and trains, and we have callers, we've had sentences, we have a structured curriculum, and we actually have chosen to color a specific color, and our current color right now is purple. For more healthcare news, there's a job fair with the Dallas Independent School District. A career fair with the Dallas Independent School District, and that's on April 11, 2015. And I also want to remind you about the health fair on April 11th, 2015, with Cosmo. That starts by 9 a.m. and with a clinical station by 1 p.m. And also we we're also able to collaborate with graduate medical education programs globally on case studies, which are the caveat for this collaboration. We are ranging from cerebral palsy, sexual domestic violence, sickle cell disease, atrial fibrillation, Parkinson's disease, HIV and violence in women, procedures, anything from embolectomy, cerebral aneurysm clipping, and cholecystectomy. And we're going to be doing live expositions on these case studies and procedures here on this collaboration portal. Um, with that, I would also I want to check if there's on the data from collaboration, on our collaboration modalities. Yeah, and I want to thank all our collaborators for this information that are very that provide up-to-date information on the various up-to-date um, careers and the various global events, and also provide an opportunity for this collaboration to provide a collaboration portal for I'll be part of these of global collaboration. So the next and also I want to remind you that you can be able to sign up on our various collaboration portals, and due to our schedule, our kaleidoscopic physical activities, which are listed on our collaboration portals, will complete our schedule for this week. And I want to and I invite you to our night float system, and also want to wish you a wonderful weekend, and end the show by approximately 8:05 a.m. Central Time. And thank you again for collaborating with the Melange collaboration.